Good afternoon, everyone. This is Dr. Vikram Pavade. I am the orthopedic consultant at Apollo Hospital, Navi Mumbai. My special interest is in joint replacement and arthroscopies. I do revisions as well. I got my training for 20 years in UK, and following that I am back to the place where I belong. Today, as we all know, is the World Arthritis Day, and I am glad I have been given an opportunity to speak about that. The first question is, what exactly is meant by arthritis? As you can imagine, this is a normal hip joint, and because the cartilage over here is intact, but you can see there is some fissuring of brown color, and when this cartilage gets worn out, we start getting pain. It is just like enamel of the tooth. When it is intact, you don't have any pain, but the moment it is eroded, there are cavities, you start having pain because the bone underneath is richly supplied by blood vessel and nerves. Why osteoarthritis happens? It happens because of the old age, because of the wear and tear. We are still unable to fathom how it exactly happens, because cartilage, as you can see, doesn't have any blood and nerve like enamel, tooth or nail, and it is there to protect us from pain. In some cases it is worn out much earlier, like in one knee compared to the other. Somebody might have at the age of 50, somebody might be normal up to the age of 80. There are a few things which can lead to further deterioration in the joint or the cartilage, and they are obesity, serum uric acid is raised in gout, so in that case also the joint gets degenerated. Post-traumatic arthritis, like you had a trauma, nasty injury to the hip or knee, and then it will accelerate the arthritis. And rheumatoid arthritis, where there is inflammation of the joint. So these all conditions can lead to earlier development of the joint pain. How can we prevent osteoarthritis? This is very important because I think prevention is better than care. So keeping your weight under control, doing exercises, and taking occasional analgesics, safe analgesics like paracetamol is good enough. You don't need to take anti-inflammatories, because if you keep on taking anti-inflammatories, although the pain relief is good, in long term they all cause serious problems like severe stomach upset, acidity or kidney failure, and you might need a renal transplant. About the other modalities of treating osteoarthritis, we can have multiple injections like steroid or platelet-rich plasma or stem cell. But they give a temporary respite of 3 months to 1 year. But they can't be offered as a lasting solution for osteoarthritis. Then what can be done to prevent osteoarthritis? The first thing I would say is, after particular age, you should do impact loading exercises like jumping and landing up on your leg. This could be for ladies who are involved in Zumba and step up. If by 18 and 20 years of age, by all means go ahead. But if you are obese, you are having already pain in the knee joint, say you are 50 or 60 years of age, then I would encourage these impact loading exercises like basketball for men. But what you can do is, walking is very good. You can still do jogging. We don't consider jogging as an impact loading exercise. And swimming is the best because it doesn't put any weight on your joint. If suppose somebody is just 30 or 35 years of age, and if his legs are bowed, then we can do some corrective osteotomies and make the legs straight. That will cause equal distribution of the weight, and that will help you in the long term. Sometimes we noticed that only one part of the joint is involved. So we can do a unicondylar knee, like only one part of the knee, partial knee joint replacement. Then the question or the cases I am being referred by GP who have just got a mild pain and they have been referred to me for knee joint replacement. That should not be the case. Generally, initially you just manage with exercise, physiotherapy, analgesics, and when your activities of daily life get affected, that means you can't walk for 10 minutes. Climbing up and down the stairs is a big arduous task for you. We don't encourage to kneel down like when you are praying, or sit cross-legged on the floor, or to use Indian washrooms. These are the conditions when you should seriously consider a joint replacement arthroplasty. So as I have shown you this specimen, the cartilage is getting eroded. So what we do is, we just replace that part. In that case, the ball is with this steel ball. Nowadays it is the ceramic and the cup over there. So you can do your activities of daily life. You have to follow some precaution like not sitting cross-legged initially, but after 6 months you can do that. All surgeries are with the risk. So infection and dislocation in the hip we are worried about. But fortunately they are less than 1%. The most common joint affected in the India is the knee joint. So the word joint replacement, in my opinion, is a bit of a misnomer. So you see, this blue is your normal bone. So what we do is just make a cut, put this steel tray and put a plastic on it. And on the upper side, we make a hexagonal cut and then we put some cement and fix this over it. And that is how your joint is. So it is a resurfacing. We are not throwing away your own knee joint and taking a cadaver and harvesting a knee joint and then putting it on your knee. So it is just like putting a cap on the teeth or a knee joint resurfacing arthroplasty. What is the outcome? That is very important because people assume we are doing some type of cosmetic surgery. I always tell them, generally people come to me quite late, they come to me for revision where their first surgeries have failed. I always tell them, give us at least 2 to 6 weeks time. Although you'll be walking from day one, but then you'll graduate it to cane and then you can walk independently. This knee joint will last you for 25 years on an average. But if you are young and you want to do football, not exactly football, a tennis or golf, then it might wear out earlier. First revision is always very easy, but each successive revision becomes difficult. But at Apollo, we have got all the advanced instrument and the special things that are needed to do a proper knee joint replacement arthroplasty. That should be done when your activities of daily life get affected, and it is the most successful operation, and you should think it judiciously when you need it. Your suggestions are welcome. Thank you.